This is part 2 of a presentation on bimodal consciousness by Dr. David San Filippo. The characteristics of the bimodal brain reflect the different types of stimuli, reasoning, and responses the human will have as a result of having two hemispheres of consciousness. Split brain surgery research has had a marked influence on the research of the bimodal mind. The corpus callosum normally connects the two sides of the cerebrum and keeps them up to date with each other. By surgically separating the corpus callosum, a large nerve fiber system that connects the right and left hemisphere of the brain, researchers have been able to study the types of consciousness associated with the right and left brain hemispheres. Consciousness research has significantly been advanced as a result of split brain research. It has provided data to effectively study both sides of the brain. Without separating the corpus callosum, the two hemispheres would continually update each other and therefore would eliminate the isolation of the response of the researched hemisphere. By separating the corpus callosum, the two hemispheres operate independently and can be studied separately. Roger Sperry has argued that the results of split brain research point to the doubling of consciousness in these individuals. He states, "Everything we have seen so far indicates that the surgery has left these people with two separate minds, that is, two separate spheres of consciousness. What is experienced in the right hemisphere seems to lie entirely outside the realm of experience of the left hemisphere. This mental dimension has been demonstrated in regard to perception, cognition, volition, learning, and memory." The two hemispheres of the human cerebrum record and react to stimuli that is presented to it by the opposite side of the body. The right side of the body is reactive to the left side of the brain, and the left side of the body is reactive to the right side of the brain. A normal, intact brain will record and respond to information such as a picture or a written word which is presented to the left eye and projected to the right side of the brain. The data is quickly named, and if a response is necessary, will respond accordingly. However, if a picture is presented to the right eye of a split brain individual, the individual will be able to name the item quickly. The picture has been presented to the dominant left side of the brain, the location of language and speech, and therefore the individual can verbally identify the picture. A picture that is presented to the left eye is read by the right side of the brain, but is unable to be identified, although the individual intuitively knows what the picture means. The right side of the brain cannot talk, therefore the left side of the brain that has not seen the picture cannot report the projection. However, if the individual is asked to point to the same picture that is being presented to the right brain, the picture will be identified. In an example, the command walk was flashed to the right hemisphere of a patient, and the patient stood up from his chair and began to leave the testing van. When asked where he was going, his left brain said, "I'm going to the house to get a Coke." The human brain must have order to maintain a balance of understanding. Therefore, in the previous example, when the patient responded to the right brain cue, the left had to make sense of the action, so it rationalized that it was going somewhere to get something. Galen believes that during such moments of disconnection, the left hemisphere alone governs the consciousness. Mental events in the right hemisphere, however, continue a life of their own and act as a Freudian unconsciousness, as an independent reservoir of inaccessible cognition which may create uneasy emotional states in a person. The left hemisphere is the dominant side of the brain for most people. It attempts to dominate learning and responses to stimuli and data. The left side dominates verbal responses and logical, analytical, and rational thought. The right brain can express itself through creativity such as art and music, and by nonverbal, unconscious activities such as improvisational dance and emotions and dreaming. Several investigators have suggested that dreaming is a part of the realm of the right hemisphere. Some believe that the right hemisphere does all the dreaming, Others feel that the dream state allows the right hemisphere to express itself more freely than usual because the left hemisphere does not dominate or interfere. Another consideration is that a number of altered states of consciousness, such as trance states, hypnosis, meditation, and dreaming, have been associated with the right brain functions such as visual imagery and recognition of emotional overtones of external stimuli. Also, the right brain is often said to be unconscious because the split brain patient cannot verbally explain right brain activities, so that in recalling and recording dreams and other image-based experiences, we are speaking about our unconsciousness. Split brain research has demonstrated that each hemisphere of the brain has a separate plane of consciousness, dependent upon its characteristics. In normal individuals whose corpus calcium has not been severed, the two hemispheres communicate with each other and update the learning of each other. Effective learning is directly related to the level of development and utilization of the characteristics of both hemispheres of the brain. By utilizing both hemispheres of the brain, the individual will achieve a higher level of total consciousness and acquisition of knowledge. Split brain research has had a significant impact on the research of the bimodal consciousness of the human brain. As a result of this research work, researchers have been able to effectively isolate and evaluate the characteristics and functions of the right and left hemispheres of the human brain. Consciousness functions in both hemispheres of the cerebrum of the brain and interprets, responds, and records data in its characteristic modality. The left side of the cerebrum is considered to be the dominant side to most individuals due to its effective skills in language and mathematical abilities, and its deductive aspects of language and analytical thinking. The right hemisphere specializes in parallel pictorial spatial thinking. According to Tolis, it is believed that the unconscious mind operates in this hemisphere since, according to researchers, it is the side of the brain that meditation, dreaming, and intuition take place. Knowledge is acquired through the conscious and unconscious awareness of all the senses of the human body, which are sent for interpretation, action, and recording to the appropriate cerebral hemisphere. Whether the individual is right or left-handed, in a normal human brain, this information is shared with the other hemisphere, and each hemisphere learns about the knowledge, creating stimuli by its characteristic. If the child in the previously described "I love you" example has always been exposed to the word "I love you" and the facial expression "I hate you," then the child will learn that this is a normal verbal and nonverbal response. Effective teaching should involve both hemispheres of the brain in order to effectively learn. By using both hemispheres in learning, the individual will be more richly understand, respond, and record the learning experience. As you will note in this presentation, there has been verbal presentation along with nonverbal visual in order to accent the learning activity to affect both the left and right hemispheres of your brain.